For that, Tony, and we'll move on now, please, to the TeamMed Nepal presentation. Shuen.
Mm. Hello, everyone. Thank you so much for having us here today. Um, Excuse my voice. I've got a bit of a cough going, so that's that. But hi, everyone. So as you can see, we're Team Met Nepal. So I'm just here to tell you a little bit more today about who we are and our efforts in Nepal in collaboration with HGO, which is the Himalayan Guge Organization, an NGO that we work with in Nepal. Next slide, please. So we are from Monash University, and we're a student-led NGO that enables the students from Monash University to contribute to underserved communities across the world. So we've got initiatives in Nepal, India, Philippines, and Uganda, and we do annual trips to these countries to do health camps for free. And specifically, I'm going to be talking to you about the Nepal initiative today. So we have been operating for more than 10 years and working with HGO, uh, and they really understand the local community beneficiaries, the culture, and the geography. So that allows us as students to go beyond purely clinical interventions and limiting ourselves to short-term measures such as just the healthcare clinic, although that really matters as well. Um, but we can also focus on culturally appropriate practices that are more sustainable and that allows us to address some of the really big issues, such as availability, accessibility, and affordability of healthcare for these rural communities. We are currently serving the community of Bakanji. Next slide, please. So this is a bit about Bakanji. The photo on the left bottom corner is really small. I apologize for that, but basically the two circles draw out Kathmandu, the capital of Nepal, and Bakanji, where we usually go to. So we usually take a 4-day trek to Bakanji with the team. Usually there's 16 medical students or Monash University students, and we work together with a local doctor from Nepal to administer this health camp. So in this area of Bakanji, it is a village in northeastern Nepal, really near Mount Everest, at an altitude of about 2,400 meters. And it is one of the really rural communities in mountains, which then brings about a lot of geographical challenges in attracting healthcare talents and even for people to walk out of these villages to access healthcare and for anybody to leave the villages to make generational change and possibly come back to the village to offer healthcare in the future. So, with a population of about 1,200, uh, they do have some infrastructure. You can see in the photo that, yes, they've got buildings, they've got houses, but the infrastructure for healthcare is still largely lacking. Many of them have never seen a doctor or a dentist in our lives. And I think that's a really stark contrast from how many of us tend to fear dentist visits. You know, we get so scared of dentist visits, but some of them have never seen a dentist. They don't know what a dentist is. And in temperatures in winter where it can go up to -7 degrees at night, many of them don't have running warm water and there's highly volatile electricity supplies as well. Some people are lucky enough to have a water heater that allows them to at least take slightly warm showers, but because the electricity supply is so volatile, it practically doesn't work every other day. And sometimes the people there have to go for days without showering because of this as well. Next slide, please. So what we do every year is we try to set up a rural health camp that's for free. Um, and I think if you click on this slide, the video will play, uh, if that's possible. Ooh, okay, so this was meant to be a video, but I don't think it's playing very well. So you can see that this is the health post that has actually been set up in collaboration with the district government of Bakanji. And this is equivalent to the nearest GP clinic that they have. However, you can probably tell that it is very different from what we're used to when we talk about GP clinics. And Roshan, the health officer who runs this place, he's not a fully accredited doctor, so he doesn't have like an MD, MBBS degree, anything like that because we this area still has difficulty attracting healthcare professionals like that because of how difficult it is. And as a result, the population gets access to a really limited scope of treatments and prescriptions because Roshan is limited by his accreditations. And therefore, when they try and access healthcare, the nearest hospital or healthcare facility other than this health post is 7 hours on foot. So, and we also need to factor in the difficulty in accessibility, affordability, and availability that this task brings up because a lot of people have to trek so far to get healthcare. Sometimes it means they miss 1 to 2 days of work. It means that they cannot take care of their families. It means that they struggle to put food on the table just because they're trying to get the healthcare that they need. And this is already a health post that was set up in collaboration with the district government. So that's how much they're struggling with healthcare in this area. So next slide, please. Um, these are some of the photos that show you what we've been doing in our rural health camps. That's where we decided to come in with HDO to serve these communities with rural health camps. It sounds like a short-term measure, and we do have a relatively short-term impact for these 4 days. However, it allows us to serve 300 patients approximately every year across 4 days. And these range from children in, say, 5 to 6 years old, all the way to elderly who are in their 80s and 90s. So during this time, we're able to see a lot of patients with highly preventable illnesses as well, such as joint degeneration. And we also see in children because they have to hike to school for about an hour or two sometimes. So we see a lot of people, a lot of children come in with really bad joint pain. We see a lot of stuff like heart problems, GORD, a lot of girls who also struggle with extreme pain and period volume, a lot of high blood pressure, and a lot of these things are highly preventable. So during these health camps, we offer medical consultations, basic treatments because we're also limited by the number of supplies that we can bring up through the mountains. We also offer referrals. We do prescriptions that people can actually come back and refill for free because we leave some of the medical supplies that we bring with us with Roshan at the health post. And as I mentioned before, because a lot of these conditions are highly preventable, we've also been offering health literacy education. So if you look at the photo in the bottom left corner, that's a photo of me and a couple of the team members. We're actually teaching them how to brush their teeth properly, giving out toothbrushes, toothpaste, and also telling them how many times a day they should be brushing their teeth. We've also expanded this program to have flyers that talk about women's health, basic nutrition, how to manage heart problems, how to prevent high blood pressure, things like that. So that's just a very basic overview of the health camps that we offer every year. Next slide, please. So with 300 plus patients coming to see us every year, some of them take a 10-hour round trip hike to see us. And we definitely want to be able to continue this work and move beyond the short-term impacts that I've sort of been talking about. And that is where we really need help from the Rotary clubs or anybody who's able to, support us a little bit because every year we do fundraising through events such as bake sales. And we also have collaborations with a few Rotary clubs that very kindly donate every year or allow us to do market booths at their markets to raise funds as well. However, the more support we get, the more medications and supplies we can bring with us every year. And, with seeing the local situation, we've also been looking at getting, say, more mobility aids. A lot of the people hiking up to the clinics, they were using twigs and sticks as walking sticks. And this really limits the amount that they can move around in the mountains because that's where they live. They need to get the living supplies and everything. And it's very hard for them to move around without proper mobility aids. And also for a lot of the girls who have periods, many of them struggle with hygiene problems, as some of the project leads has also mentioned hygiene problems. So we want to be able to help them with these as well. And an ambulance jeep is something that we're working towards in collaboration with the district government. So we're also looking to perhaps get a Rotary grant if that's possible, or any support for it would be great. It is going to cost us a fair bit, around 23,000 AUD excluding taxes, but this would really, really help with the issue of accessibility. Like I mentioned, a lot of people have to hike about 7 hours, and that's just unrealistic for someone who's got a heart attack. If they come into the health post with a heart attack, making them hike 7 hours to the clinic, to the hospital, is just not going to work out. And even with options such as hiring Jeeps, which would be for us like the equivalent of a taxi or an Uber, that costs a few $100s per hire. And a lot of these people, they earn about $1,000 a year per capita. So that's just kind of impossible for them. And also, we want to be able to do more health literacy education and expand that program even more so we can prevent a lot of these illnesses that would be a lot easier if they had all of this information from the start. Um, and next slide, please. So I've breezed through a lot of this project, which is a lot bigger than I'm going to be able to explain a lot of here in detail, but we just wanted to show you that this is some of the impact as well that we've had with the local community. And this is some of the things that Tashi, who's the head of HDO, has conveyed to us from the local community in Bakanji. And with your support, we definitely hope to continue making a huge difference to the people of this community and the surrounding areas as well. Yeah, thank you so much. And on the next slide, there's an email there. So if anybody's interested in finding out more, because I've definitely been talking very briefly about all these things, feel free to email us, and we're very happy to do a more detailed talk anytime soon.